All right, let's dive into the fascinating world of homeopathic prescribing. It's a practice where the tiny, specific details of a person's experience can matter way more than the general diagnosis they're given. And that right there leads to a big question a lot of people have right off the bat. I mean, think about it, right? You have two people, both with a cold, sniffling, coughing, the whole deal. But one gets remedy A and the other gets remedy B. How is that possible? Well, answering that question gets us right to the absolute core of how a homeopathy works. The answer is the single powerful idea, individualization. You see, in homeopathy, the name of the disease, the common cold, isn't the most important thing. What's crucial is how that cold shows up in you. It's about the symptoms that are strange and unique to you as an individual, not the boring old symptoms that everyone with a cold gets. So, here's a great way to think about it. Picture a homeopathic physician less like a lab coat and more like a detective. Their job isn't just to name the crime, the disease. It's to find all the peculiar little clues that tell the full story of what's happening. And to do that, every good detective needs a toolkit. And that's what we're looking at today. This toolkit has 5 main methods, or you could say 5 different lenses to look at a case through. We've got the Keynote, the constitutional, the miasmatic, the pathological, and the palliative methods. The real art, the real skill, is knowing which tool to pull out and when. So let's grab the first tool from the kit. This one is all about finding that one single, striking clue that just cracks the whole case wide open. This is what's known as the Keynote method. With a Keynote prescription, you're zooming in on what are called characteristic symptoms. These are the symptoms that are just weird. They're peculiar, they stand out. So we're not talking about the generic cough everyone with a cold has. We're talking about the strange, barking cough that only happens at 2 a.m. and feels better when you drink cold water. That's the clue. And here is a perfect example. A fever, okay, that's common. But what about a fever that comes on suddenly, right after you've been out in a dry, cold wind? And on top of that, you're incredibly restless and have this crazy thirst you just can't quench? That very specific, unique combination, that's a massive keynote pointing straight to the remedy, aconite. So you might be wondering, does this approach actually work? Well, a pilot study took a look at 30 cases where this method was used. And the big headline, a whopping 2/3 of the patients, 66%, had what they called a good response. That means they felt more than 75% better. And when you look at the full picture, it's even more interesting. On top of that 66%, another 28% had a moderate improvement. So what this data suggests is that when you can find those really clear, peculiar symptoms, the Keynote method can be a really powerful tool. The data shows us what happened, but this quote from the famous homeopath Dr. J.T. Kent really explains why. He said, "You cannot individualize except you have that which characterizes." In other words, without those unique details, those keynotes, the whole idea of treating the individual just falls apart. They're the very things that make a case solvable. Okay, but what happens when the clues aren't so obvious on the surface? What if the problem is older or deeper? Well, that's when our detective has to put down the magnifying glass and start digging. And this brings us to the constitutional and miasmatic approaches. Now, these two methods go way deeper. Constitutional prescribing is totally holistic. It's looking at everything about you, your personality, your emotional state, even your physical build, to find a remedy that fits your entire being for long-term health. Miasmatic prescribing goes even one step further, looking at deep-seated, often inherited predispositions, things like a strong family history of a certain illness that might be getting in the way. So a physician pulls out these heavier tools for chronic, long-term problems, or when the goal is to really strengthen the body's overall immune system and prevent things from coming back. They're also super important when a case just feels stuck or confusing. Sometimes you use these approaches to unlock the case and see what's really going on underneath. Now we have to shift gears and talk about situations where the detective is faced with the hard, physical reality of an advanced disease. In these cases, the focus has to change, and that's where the pathological and palliative methods come in. A pathological prescription is used when there are real, significant structural changes in the body. We're talking about things like cancer or other serious conditions. Here, the remedy is chosen because we know it can produce effects that are very similar to the disease process itself. It's a method you turn to when those unique, personalizing symptoms are just not there to guide you. And then there is palliative care,
which has a very clear and, frankly, very compassionate goal to relieve suffering. In situations where an illness is incurable or terminal, the number one priority is comfort and pain relief, using remedies to improve the patient's quality of life as much as possible. So, just to be clear, these last two tools are really reserved for the most serious circumstances. We're talking severe diseases, terminal illnesses, or any situation with extreme pain. They're also essential when a patient's true symptoms have been covered up or masked by other treatments, forcing the doctor to deal with the physical reality right in front of them. Okay, we've laid out all the tools in the detective's toolkit, from the quick, sharp Keynote to the deep-diving miasmatic analysis. And all of this leads us to the most practical and important question of all. I mean, this is it. This is the whole ballgame. How does a practitioner look at a complex person sitting in front of them with their entire history and all their symptoms and decide which of these methods is the right way forward? And here it is. This is the decision-making framework. It really boils down to this. If you have clear, strange, unique symptoms, especially in something that came on suddenly, Keynote is your go-to. For long-term chronic problems, you need a constitutional approach. If the case feels stuck or there's a deep family pattern, you look at the miasmatic level. And for severe physical disease or end-of-life care, the pathological and palliative tools are what you reach for. But, and this is the final, most crucial point, this isn't some rigid, robotic flowchart. As one source puts it so well, experienced physicians learn to fluidly switch from one method to another depending on the case. It's not a rigid science of rules, it's an art. The artistic aspects of case study, as they call it. And that really leaves you with a thought, doesn't it? In an era so focused on algorithms and data, what can we learn from an approach that celebrates the art of healing?